So good afternoon, good morning, good evening to you all, and welcome to the launch of the 2021 Partners Health Policy and Systems Research Report. My name is Aku Kwame. I'm a technical officer with the Alliance for Health Policy and Systems Research, and I'm absolutely delighted to be here today with several esteemed speakers to present this report that has been developed collectively and collaboratively over the past year. First, some housekeeping. So this session is being recorded, and we will be posting the recording on the Alliance website. We also want you to invite you to share your questions for the panelists in the Q&A box. We also invite you to drop your name and your affiliation in the chat box. Let us know where you are joining from today. And we also encourage you to have a conversation amongst yourselves in the chat as well. Now, first, to give you just a bit of background to the report before turning over to my colleague who will present the report. Next slide, please. So this is the website where you can find the report. The link will also be posted in the chat. And as we present the report to you, you can navigate your way through it and explore it a little bit. Next slide, please. So to introduce this 2021 report, it emerged from work that we've been doing at the Alliance, trying to strengthen our partnerships. We had heard from partners and that it would be desired, aspirational, to see how we could not only strengthen our partnership, but also develop collaboratively and collectively an account of health policy and systems research globally. One that could enable benchmarking around common indicators for health policy and systems research, and one that would help us to monitor the change in terms of HPSR production, HPSR capacity strengthening, and HPSR financing. And we sought to create something that would speak to both national audiences and international audiences to support not only the call for advocating for further investments in health policy and systems research, but also clarifying the terminology and understanding exactly how HPSR is being organized in countries. So I'm delighted to present today, to introduce today, my colleague, Jeff Knezovich, who will show us what this report looks like. Next slide, please. Now, Jeff is a technical officer with the Alliance. He's focused on partnerships and engagement, and he's a passionate research communicator who focuses on digital communications and data visualization, as we'll see. He leads the strategic public engagement efforts of the Alliance, and Jeff comes from a long-standing background working with think tanks across different domains in international development, in health policy, and in foreign affairs, working at the research, policy, and practice interface. So Jeff, let me hand it over to you.
Thank you so much, Aku, for that kind introduction. And it's great to see all of the partners with us today. This has been such a collaborative effort, and we really think that we have been able to take this report and do something really innovative with all of that collaborative effort. So if I could have the next slide, please. What we've done is we have been able to turn this into a digital report, as you will see if you've been able to go to the link. So it's only available as a web page, but it scrolls through, as you can see, and is available to access online. I'm afraid that means that there's no PDF, but I hope that this allows you to share the different country profiles and things that are included in the report. Next slide, please. To give an idea of the scope of the report itself covers 16 countries, which are mostly low and middle income countries, with the exception of Trinidad and Tobago, which is a high income developing country. And in each of these country profiles that are available, the partners, their lead partners who've helped or who've led the data collection in these different countries. In addition to the country profiles, we also have 2 global entities that have contributed, both Health Systems Global and the Health System Strengthening Accelerator from R4D. And I know that we have one of those colleagues online today who will be chatting with us in the panel discussion. And finally, these reports cover a total of 378 institutions around the globe. Mostly, we found that these HPSR institutions are at universities, but we also have a number of think tanks, international agencies and NGOs, local NGOs, government entities, and even a few hospitals or health service providers that have research functions embedded in them. Next slide, please. In terms of the country profiles, together with the partners, we iterated and focused on 4 main domains to explore indicators that we can benchmark and develop in the future. In particular, each country profile has a section on knowledge generation, a section on engaging policymakers and the public, a section on academic and institutional capacity, and a final section on HPSR financing that looks both at the national or government finances as well as what we were able to identify within institutions themselves. That was one of the big findings I'm sure we will discuss in our panel discussion of the difficulty of really assessing the HPSR financing landscape in these countries. But nevertheless, we think that it's an important thing that this report has added value to. Yes, please, next slide. I do want to keep this brief. I think they say never have a talk that keeps people from their food, but in this case, I think it's never have a talk that keeps people from an excellent panel discussion, which I know that we're all looking forward to. But just to say that as you are looking at this report online, there is the menu at the very top that will help you to navigate through the overview where we provide a bit of a summary, the global perspective I mentioned, and each of the country profiles. And the last slide from me is just to say a little bit about future directions, which is that this is our first iteration. It's been a learning process for us, absolutely, and I think all of our partners as well. And we hope to use this as a really important foundation for future reports, but also as the beginning of an institutional database of HPSR institutions around the world. So I will put this link as well in the chat as we go along, but if you might be interested in joining future editions of this report or making sure that your institution is included and covered, we have a place for you to express your interest in joining, and there is a survey for that now. And based on that, we will be in touch. But with that, I will leave you to explore the digital report and also hand it back over to my colleague, Aku, to facilitate, I'm sure, what will be a fascinating panel discussion. Thank you so much.
Jeff, thank you very much. Thank you for showing us the reports. I hope that as we're speaking that people are taking their time to click through. It's really a very rich report. And so with that, we are so excited to now introduce our panelists. It's been such a delight not only working with them and learning with them, not just in the elaboration of this report, but previously as well. And we collectively are really just delighted to have what Jeff says is going to be a fascinating, a stimulating, a provocative, and we hope timely discussion as well. So without further ado, let me introduce the panelists. Dr. Aissa DIARRA is a medical doctor by training and a holder of a doctorate and a degree in sociology and anthropology and ethnology. She's a researcher at the Laboratoire d'études et Recherche sociale et le développement local, that's LASDEL in Niger, where she is in charge of the health section. She's a specialist in maternal health issues in Africa, but also works more broadly on power and gender relations. Our next panelist is Dr. Ping He. Dr. Ping is an associate professor of health economics at Peking University, China Center for Health Development Studies, with main interests in experimental and quasi-experimental studies of healthcare and policy. He is the first managing editor of the Chinese Journal of Health Policy and is widely published. Our third panelist is Dr. Nathan Blanchet. Dr. Nathan Blanchet is a health system specialist with experience in research, teaching, and nonprofit program leadership. He is a visiting scientist at Harvard University's T.H. Chan School of Public Health. And as a senior program director at Results for Development, he serves as project director for the Health Systems Strengthening Accelerator. Our fourth panelist, next slide please, is Professor Fadi EL-JARDALI, who is the founding director of the Knowledge to Policy Center at the American University of Beirut in Lebanon. He's the co-director of the Center for Systematic Reviews in Health Policy and Systems Research, the director of the WHO Collaborating Center for Evidence-Informed Policy and Practice, and he's also the co-editor-in-chief for Health Research Policy and Systems Journal. Our fifth panelist is Professor Lucy GILSON, who is the head of Health Policy and Systems Division at the University of Cape Town in South Africa, and professor of Health Policy and Systems at the London School of Hygiene and Tropical Medicine. Her recent areas of work include conceptual and empirical work on health systems resilience, health systems governance, and leadership. And she has a long-standing interest in politics of health policy change and implementation. And our sixth panelist is Dr. Miguel GONZÁLEZ-BLOCK, who is an associate researcher at the Faculty of Health Sciences of Anáhuac University, and honorary researcher of the National Institute of Public Health in Mexico. He serves as director for Mexico of the North American Observatory of Health Systems and is the director of EVISIS Health Systems Consulting. He's a member of the National Academy of Medicine of Mexico and of the National Systems of Researchers Level 3. So with that, I want to welcome all of the panelists, and I'll invite you to turn on your microphones and your cameras now. I also want to say that in addition to the esteemed speakers that we have here today, we also are joined on the line, but also in the report by a selection of leading teams in health policy and systems research. So we want to recognize and acknowledge everyone. But thank you to the panelists for being here. So Lucy, I might come to you with the first question. Jeff has told us a little bit what is in the report. And my first question would be for you to speak to us a little bit about why it is important to conduct such kinds of assessments for health policy and systems research.
Thanks very much, Aku, and thanks to the Alliance for inviting me today and for coordinating and initiating this piece of work, which is the latest in a long line of Alliance activities to track HPSR within countries and its development over time. So I believe that it's important that we do this sort of work to enable countries to learn from each other in the first instance, so that we can see what other countries are doing and we can see how HPSR is evolving at country level, and within our own countries we can then learn and track our own experiences. And I think that is important in enabling debate at country level about what HPSR is, what it does, why it's important, why we need to fund it, amongst other things. I think also this sort of work clearly feeds back into global level debates about what HPSR is and what it does, and why it's important to fund it again at a global level. I finally wanted to comment that I think that as we engage with national level work on HPSR, we must acknowledge that we are increasingly contributing to those global debates. So as HPSR researchers, we're not only doing work that speaks back to our country contexts, we are ourselves doing work that speaks to global debates. So understanding country level activities is important in understanding the collective of global HPSR activities. Thanks, Aku.
Thanks very much, Lucy, and thanks for getting us started off on a very great foot. Perhaps just on that last point, that enabling debate and allowing countries to contribute also to the global level. Nathan, perhaps I can come to you on this point from the perspective of a global actor. And just looking at that perspective of how global actors can support countries to increase their HPSR production, but also how do you see that tension between sort of the national level and the global level for HPSR?
Great, thank you for a great question, Aku. And let me just start off by saying good morning and good afternoon to everyone. And thank you on my part for inviting me. It's fantastic to join everyone here, and I'm thrilled to be on a panel with some leading scholars who actually influenced, though they may not know it, early parts of my career. So it's great to be here, and congratulations to the Alliance for this, I think, quite important and innovative report. I really like many features about it, including the way it's set up to walk through country by country and see the variation. And as Lucy said, see how countries can learn from one another. So as your question suggests, I currently am leading a global health system strengthening project. It's funded by USAID, called the Health System Strengthening Accelerator. And we have had several occasions now to try to be in a position to support an HPSR ecosystem at a regional level with Asia region-based HPSR institutions in collaboration with the Alliance. We also support specific initiatives to support certain changes going on in particular countries. We're supporting a learning agenda for Guinea's community health strategy. We're doing some implementation research alongside the Ghana Health Service Research Directorate for a scale-up of primary care delivery innovation there, and others. The tension that you described, and I think this report is really going to help with, is that we are trying to not really be the leaders and the doers of that particular research. We don't see that as our role. Results for Development, the organization that I work for and leads the accelerator, has a mission to support change agents to lead health system changes in their country. And we believe that health policy and systems research is a big part of driving that change. And so what we try to work on is how we can be good external facilitators of that. Sometimes that starts with changing the unit of analysis, I would say. And rather than the unit being what research can we do on what topic to produce what new finding, the unit is rather exactly as it is in this report. The unit is the 378 institutions that are profiled here, or perhaps it's the 16 countries that are there. And the question becomes for us, all right, there's a challenge in this country, there's a challenge that these institutions, particular institutions, have to have a role to play in contributing to. What best way can we facilitate that? Can we set up processes that bring them in to planning processes they might not otherwise have been invited into? Can we give support in terms of skills development? Can we offer cross-country learning? For example, examples of how, let's say, implementation research has guided a similar policy in another country, so that folks are aware of that. So that's, I think I'll stop there. Thank you.
Nathan, thank you very much for that reflection, and your comment about countries really sort of taking the lead in the doing and supporting that change, and sometimes changing the unit of analysis. I find that quite interesting. Aissa, perhaps I can come to you next and just jump off the points that Nathan raised, because Niger is not a country that we have heard much about in terms of HPSR. We know that there's a lot of very interesting work that has been going on for many, many years, not least because of the work that you and colleagues have been doing at LASDEL. But perhaps you could share with us your reflections in participating in this exercise. What perhaps was surprising for you, either in terms of what you found or what you did not find? So if you could share that with us, please.
Merci, bonjour à tout le monde. Moi, je vais m'exprimer en français, parce que bon, Alliance, OMS, c'est aussi les autres langues, c'est pas que l'anglais. D'abord, je voudrais remercier le groupe Alliance d'avoir associé le LASDEL à l'élaboration de ce premier rapport mondial sur les politiques et les systèmes de santé. Nous sommes particulièrement fiers, en tout cas au Niger, d'avoir été choisis avec les 15 autres pays pour ce premier rapport. Nous remercions également, donc le LASDEL remercie particulièrement donc les collègues et puis les partenaires du Niger qui ont bien voulu participer à la collecte des données. Alors, pour répondre à ta réponse, à ta question, pardon, Akou, il faut dire que la plus grande surprise, en tout cas de notre côté, lorsque nous avons donc fait la revue des résultats de cette collecte, c'est qu'il y a de manière vraiment surprenante le nombre croissant d'articles de presse ou d'apparitions de chercheurs sur les médias sur les sujets liés à la santé. Ce qui signifie donc d'une manière générale que la presse vient renforcer de fait et de manière significative le rôle que jouent les conférences et les ateliers dans la diffusion des résultats de la recherche. Et donc, de fait, donc, la presse est devenue vraiment un cadre incontournable où les chercheurs peuvent diffuser les résultats de leur recherche et où les décideurs aussi viennent trouver des informations pertinentes dans le processus de décision. Je pense qu'il serait, dans cette lancée, qu'il serait quand même intéressant et très important de formaliser ce partenariat entre la recherche et la presse, donc de définir donc, les modalités de cette collaboration. Et je pense que l'une des premières choses que nous ferons, en tout cas à l'avenir, dans un avenir proche, c'est de pouvoir réunir justement des chercheurs et des journalistes pour débattre justement de comment on peut collaborer ensemble et comment on peut atteindre le public de manière plus précise encore. Autre chose, c'est que je pense aussi que le rapport sera un outil important d'information des différentes parties prenantes, à savoir le ministère, mais aussi les chercheurs et les acteurs de l'intervention, c'est-à-dire les ONG, qu'elles soient locales ou les ONG internationales. Donc, je pense que cela est important et que le ministère de la Santé, qui a une direction de la recherche, en tout cas une unité de la recherche, soit plus proactive dans ses relations avec les chercheurs et les intervenants et les acteurs des interventions pour vraiment qu'il y ait une véritable application des résultats de la recherche dans le pays. Et cela est d'autant plus important que le ministère de la Santé puisse prendre la place qui lui est dévolue, de pouvoir aider, donc appuyer les chercheurs à travailler sur des priorités qui lui sont propres, sur des priorités nationales, en plus des priorités internationales, mais il faut dire qu'il y a toujours ce décalage entre les priorités internationales et les priorités nationales qui font en sorte que chercheurs africains et décideurs africains sont sur d'autres agendas qui sont en décalage avec les réalités du contexte national. Je vous remercie.
Aissa, thank you so much for your rich comments, and thank you for providing your comments in French. Let me very briefly summarize. You raised a very important point in terms of the question of what was surprising to you. What you spoke about was really finding actually a high degree of media hits that actually were related to health in the country. That was surprising in the various kinds of media, so the print media as well, and that the media was actually playing a strong role in supporting the dissemination and in viewing conferences and workshops as quite important as avenues for researchers to be able to disseminate their findings to different kinds of stakeholders. And what you pointed out was that perhaps there was a need to formalize those kinds of relationships, bringing in journalists and researchers to work together and to also be able to feed those findings to different stakeholders, not only policymakers, but also NGOs and other actors in health. And then the final point that you raised was really about in formalizing not only these kinds of relationships, but then also other sorts of networks and fora to bring in the ministries of health, ensure that researchers are working with those policymakers on priorities of national and not always international importance, so that the findings can really be applied in the context. So very interesting comments, Aissa, and we thank you. And connected to that, Miguel, I want to come to you next, because Aissa has raised for us the issue of different kinds of actors engaging in health policy and systems research. And so I wondered, from perhaps the view from Mexico, but more broadly as well, what are the trends that you are seeing for different kinds of institutions and actors participating in HPSR? How is that diversifying over time? Miguel, over to you.
Thank you, Aku. Indeed, thank you also to all the organizers and the Alliance considering my participation and initiating this important project. Indeed, what we see in Mexico, and I believe it is also true across other countries, is an increasing diversification of actors. This is especially important in Latin American countries, given our highly segmented, inequitable health systems that have been governed through government or by public agencies for many years, and where a fresh and more independent voice is required to push them forward. So the institutions in Mexico undertaking HPSR have become more diversified, with greater participation of non-government organizations and think tanks. These are focusing the research on the evaluation of social programs, the analysis of fiscal space, taxation, and resource allocation, on transparency issues regarding decision-making, and also on human rights. Like in African, we just heard, the newspapers, journalism, lay journals are increasingly publishing on health system issues and evidence, which is very welcoming in our country. Now, all NGOs in Mexico, at least, have a national focus, although state universities are focusing on health system issues at the local level. However, they struggle with funding, and especially with dissemination and impact at the local level, where it is critical to synergize research with the capacity strengthening. We also have the need to promote further research by professional organizations, especially those representing nurses, doctors, and other health workers. We are very happy to have seen in the past decade increased involvement by the pharmaceutical industry and the insurance industry in the private sector, supporting research in a wide range of topics. Now, I want to conclude by supporting Lucy's statement. One of the main benefits of this exercise is to learn across countries and especially across regions. And in this case, I would like to invite Lucy and all others to continue discussing opportunities for learning, and particularly in Mexico, we're interested in the Health Systems Trust of South Africa, which has the right balance of research and capacity strengthening with the right governance and a great focus on issues. So I look forward to that conversation.
Miguel, thank you very much. And yes, you reiterate for us how important it is to learn across regions and learn across countries. And with that, perhaps I thought, Ping, we could come to you. One thing that is quite interesting in the report is that the report does identify that in China, much of your HPSR financing is in fact domestic, as opposed to international. And I suppose that perhaps you have something to say to us about that in terms of how it actually influences how HPSR gets organized or gets done. So if you could reflect on that for us, please.
Okay, thank you, Aku, to have me the opportunity to take this panel. I'm also very excited to find the HPSR support in this year. And I just want to share about the different story about China with other developing countries in the source of HPSR funding. And I could mention the majority of HPSR institutions, including universities and research institutions or NGOs, received more domestic funding than international funding in our country. And almost 50% of them are from the central and the local governments. From this point of view, China may face less challenge than our neighboring underdeveloped countries in the context of large decrease in the international HPS funding, especially in this COVID-19 pandemic. Maybe this is just because China has increased in the middle and high income countries several years ago. Maybe Chinese government has emphasized the investment in HPSR research. Since there is a new round of HPSR research increase during the health system reform since 2009, and lastly, and during the past 10 years, Chinese publications about HPSR, including Chinese context, and the publication also published in the international peer-reviewed journals, including some high influence journals, has experienced a rapid increase, maybe due to the reform of health system in China. Also, Chinese government also give more attention to the public about HPS research. I think this is very important factors. Now, China has a very different story with other countries, especially in the source of HPS funding. That's my main point about the HPS funding in China. Thank you.
Thank you very much for that. Very interesting reflection and food for thought. And you've given us sort of the past 10 years in terms of Chinese development in HPSR. So with that, Fadi, I wanted to come to you. As you know, throughout the elaboration of this report, as inspiring as it has not been without its challenges, particularly around methodological challenges and some definitional issues as well. But if you were to look forward 10 years, Fadi, what would you want to see in terms of perhaps strengthening indicators or measurement for HPSR? And as we update this report, what would you like to see in future iterations of this report? Fadi, over to you.
Sure, thank you, Anku. And I want join my colleagues, panelists, in congratulating the Alliance for Health Policy and System Research for this very important, strategic, and timely report and scorecard. And it will be really more of an excellent tool, advocacy tool for many countries to direct more investment in health policy and system research. Before I go there, if you allow me, I want to mention that I think one of the things that is important, in addition to all the benefits and the advantage of this work, regional comparison, funding, but also what we have seen from our context, that this work has allowed now more institutions to start speaking and reflecting on the state of health policy and system research at the country level. And I think this is a very important breakthrough in terms of how we are thinking about institutions. I think the template, talking about the methodology, the template and the measure that we have been asking them to, it was a prompt for them. It was really more of something that, like there was an aha moment for them that they were not collecting information on what need to be collected on, and they were not making use of their existing information to actually provide much more direction on that. So I just wanted to highlight how important it is also at the country level. I think many countries were, including in Lebanon, there was a lot of things that is really more of flags. Of course, no strategy, no explicit funding for health policy and system research, etc. But also very few limited institutions working with that. Not to say, as already been mentioned, also a lot of NGOs, think tanks, etc. But they are not, in fact, investing in health policy and system research. So what I'm trying to say that this report, yes, it's provide the what in terms of what we have so far. And the way we would like to see this in the future, Akko, is that we want to start asking the so what. It's not only the what, meaning really, why and how. why we have still very limited institutions that are really working and making explicit, have explicit mandate to produce and translate health policy and system research, while other institutions, they might have the capacity, but they are not going in that direction. Why we don't have explicit funding for health policy and systems research? Why institutions are not using metrics for health policy and systems research as part of their evaluation and strategy, the national strategy? There is a lot of whys that we need to ask, but also what I would like to see in terms of the how this can be used. The scorecard that is being developed is not developed for judgment purposes or comparative purposes. The scorecard is developed for improvement purposes. So we want to make sure that those scorecards for the country, and hopefully in the future, we'll have more countries that have such information. This is a moving target. This is something that, every 2-3 years we need to have this. In the meantime, there should be a dialogue, a stakeholder engagement, institution working together, developing networks at the country, regional, and the global level for that. To me, the future direction is very, very critical about that, Akko, in terms of what we would like to see. And we don't need to wait many years to get to that level. One thing we're seeing that the importance of, we want to start seeing HPSR institutionalized in the decision-making level. We want to make that link because the research part is very important, but we need to take it further to actually be part of the decision-making table. So that link is very critical. This is what I would like to see. Also, what we would like to see more innovative way in terms of funding health policy systems research at the national level, regional, and the global level. More involvement and investment on postgraduate teaching and curriculum when it comes to health policy and systems research in terms of training, more capacity for institutions for producing health policy and system research, and also linking evidence to policy when it comes to knowledge translation, building more capacity, but also we would like to see more of improvement in the data collection and metrics when it comes to health policy and system research. And this goes back to your question, there is a lot of room for improvement for that template. The template was great. It's just, the minimum data that we need to require, but this is scalable. So we need to start really thinking about what are the element that we need to add in a scalable way. So when we say about the scope of health policy and system research, there's a room for improvement there. But also when we say health policy and system research institutions, we need to be also clear what do we mean by that, because in some institutions they don't have explicit, so they have an implicit intent to produce health policy and system research, not necessarily an explicit one. So there's a lot of elements methodologically that can be improved. In terms of the template, in terms of the metrics that we're really asking for, and in terms of really more of definitions. Over to you.
Fadi, thank you very much for that. And I want to, you raised 3 questions: so what, why, and how. And we're coming to the end of our session. So those are the questions that we will pose in the closing remarks. I want to thank all of the panelists for your incisive comments. I apologize that we've just simply not had the sufficient time. Those of you who had questions, I encourage you to continue to engage with the report, and please do be in touch with us. And we hope that this report will grow over the years. So thank you very much. And we started a little bit late. So for those of you who are still on the call, we thank you for your patience. And I don't want to hesitate, but I want to now invite Dr. Ghaffar, who is the Executive Director of the Alliance, to share his closing remarks with us. So Dr. Ghaffar, over to you.
Thank you, Aku. Thank you, colleagues. And I'm very happy that we have organized this session and we have launched this report. So I just wanted to appreciate everybody's contribution. However, I just wanted to share a few things that why we have moved. As you know, like we launched the WHO strategy on health policy and systems research in 2012. WHO launched its research report where we pushed for the agenda for the more demand-driven research, which is part of the HPSR, as Fadi was saying. Then we had a report which was a world report on health policy and systems research in 2017. And as I think Lucy said in the beginning, we have been like trying to do such work over the years, and all the partners who has very kindly contributed and made it sure that we have a report have realized that it is not an easy thing to do. To collecting data, to getting information, to disaggregate the data for, especially for the fiscal numbers, is not easy. And then there are definitional issues. There are different people who call different, especially in the schools of public health and the community science departments and the medical schools. However, I just wanted to re-emphasize that this is a partners report. It's not the alliance report. We are convening, we are working with you, but your report, and I think as Jeff has said in the very beginning, we are open to entertain and engage with more and more partners. And more we are, stronger we are. But at the same time, as Lucy has said, perhaps the most important value of this report is that we are learning from each other, from the neighbors or not neighbors, from the countries or the institutions within that region or across the globe. And that realization that, okay, how we have overcome on challenges, how we can learn from each other, how can we contribute, how can we engage with decision makers, how can we raise funds, how can we raise capacity. And I think that is a very good, not a starting point, and one main important point which we have to learn and emphasize. And as it is a partner report, it is not the things moving from Geneva down to the country capitals. It is all coming from the country capitals. As I said, we are just collating and presenting, and hopefully one day we will be able to have all the countries in this report. And I mean it, I think it hopefully will become a reference report, especially for the benchmarking and discussions with the funders, with the policymakers, so that we need more and more funding, both for generation and use of policy relevant knowledge. So I will again make a plea to the people who are not in this report. We are looking forward to work with them, and we'd be happy to engage, and we will try to work with you as much as possible. And Jeff has given the link. If you want to join, that's the link, or write directly to either me, Aku, Jeff, or Livia, and we would be more than happy. Or just send a note if you don't have our emails to one of the partners. You are known to that. So I think one thing Fadi mentioned that, okay, we have done what and how and why. And I think that's the debate for in your and my lifetime is not going to be over. It is still a long battle. And we have to continue that because there's a prevailing mindset. And as we have the title of the 2012 WHO strategies, health policy and systems strategy name was changing mindset. And we have to work within WHO, with the development community, with the funders, with the national policymakers, with the researchers in health, and with the researcher outside health. So that we have to continue, but we are also establishing a forum which is called LEAP Forum, which is learning, engaging, and advocating for policy and systems research. And every year we will have 2 meetings, and that is going to be the agenda of why and how, and not discussing what. And we are planning that, and we will issue that call soon. And all of you would be certainly involved into that. So in the end, I just want to thank you to all the 16 country partners who has worked not for a day or an hours, but over the months, 6th January. So thank you to all of you in country institutions, because all of them are not represented here, so I just wanted to say my most sincere thanks. In addition to the countries, we requested to global partners who are really investing into the health systems research. And Nathan is here, but the Health System Global obviously is our natural partner and as like a sister organization or whatever we want to call it. But in the future, we are also looking forward to collaborate with other global entities who has explicit mandate. There's a lot of people who has some sort of implicit mandate, but we want to work with those who really mean that we want to promote and invest into health policy and systems research. And lastly, most important, to all the participants who are not panelists and the presenters, I think you are going to make a difference. You are going to be a champion, and you are the people who are really going to galvanize this movement. And this is certainly a movement. It's not a report. This report is just a mean. It's not an end. And we need to use this report or these numbers or this data to make a case within our own countries and all over the world. In the end, I just want to say my most sincere thanks to my own team, Aku, Jeff, Livia, another colleague who has worked over the year, who has picked some fights, who has like struggled to like design and devise some like matrices, numbers, institutional like engagement and collaboration. And we all know, we all want collaboration, but collaboration is not easy. It needs a lot of investment and relationship, like any other relationship we have with the family, friends, or the peers. We need to invest time in collaboration. And I'm very happy that we have been able to launch this report. And as I said, and Jeff and Aku has said, this is just a beginning. And hopefully one day we will have the most comprehensive report on health policy and systems research for all of you and for all of us. So thank you all. And Aku, over to you to close it, please, if you want to close.
Well, thank you very much, Dr. Ghaffar. And let me just apologize to everyone. I got so excited that I just got our time wrong. So in fact, we have 10 minutes before we close. We close on the half hour, not the hour. So I apologize for that missing form. But in the spirit of a partners report, I would like to give the floor to all of our panelists, maybe just to give a final 1 minute reflection. Anything that we've discussed today or anything that has not been discussed. So Lucy, if I could start with you, please.
Thanks so much, Aku. Thanks so much, Ghaffar. I would really like to call for, as we move forward, a reflection and a strengthened focus on thinking about capacity strengthening in relation to HPSR. I think one of the ways we consolidate and deepen HPSR within countries is through that a suite of capacity strengthening activities that are not directed only at researchers. And most of HPSR training, certainly in South Africa, is directed at those who work within the public sector, in fact, and increasingly in other organizations as well, or in other sectors as well. And I think we certainly need funding to continue that work, but it is through our deepening of an understanding, awareness, relevant skills through a suite of capacity strengthening activities in the broad terrain of HPSR that we create champions for HPSR domestically that will continue to take this field forward at country level and globally. So we did address capacity strengthening, but I think we can do more in future reports, and I look forward to that engagement. Thank you so much, Aku.
Thank you very much, Lucy. Nathan?
Thanks, Aku. I wanted to share one thing that we did in collaboration with the Alliance. We have a program, as I mentioned, that's trying to strengthen the ecosystem for health policy and systems research in the Asia region. We started that with a landscaping of over 70 HPSR institutions. And from what we could gather from secondary data, at least, we mapped what those institutions were doing, what they themselves said they were strong at, across 5 functions that we think lead to health system change: evidence generation, analysis of problems, formulating solutions, managing the adoption of said solutions, and then operationalization and implementation. And one thing we found was that there was the strongest amount of activity on evidence generation, almost equally strong activity on data analysis, and then a very sharp drop-off among these 70 institutions in formulations of solutions, and then even lower managing the adoption and operationalizing. My suggestion is to, as Ghaffar said, this tool is a great means to an end, and I think we can continue strengthening that means. One way would be to push a little bit beyond the 4 domains that are there and to deepen those, and maybe think about some of those other functions, how involved institutions are getting a little bit further on in the policy to action cycle. And I'll raise my hand and our organization's hand to join these collaborative efforts going forward. Thank you all very much.
Thank you very much, Nathan. Aissa, I wonder if I can come to you next for your final reflections, very briefly.
Merci. Donc moi, je pense que ce que j'avais précisé auparavant, c'était de pouvoir d'avoir une meilleure assise du ministère de la Santé pour renforcer davantage la recherche sur les politiques et les systèmes de santé, notamment que l'État puisse donc voir à travers ce rapport donc la situation réelle de la recherche dans le pays et de pouvoir donc s'impliquer davantage, c'est-à-dire subventionner les centres de recherche pour pouvoir soutenir davantage les chercheurs dans leur travail. Voilà, c'est ça en gros. Mais je voudrais quand même ajouter une dernière chose, c'est que actuellement, l'État nigérien, le gouvernement nigérien est en train de partager les résultats de recherche qui ont été produits par le LASDEL au niveau des services de l'État. Et je pense que ça, c'est une bonne chose et que avec ce rapport qui sera remis aux autorités, nous allons avoir encore plus notre position qui est renforcée auprès de l'État. Merci.
Thank you very much, Aissa. So sort of jumping off of Nathan's point there about strengthening the collaboration between ministries of health to support the use of evidence, and also supporting researchers in their ability to feedback and work with the state. So thank you very much, Aissa, for that. Ping, if I can come to you next, please.
Thank you, Aku. I just want to share one point from my point of view. I think the key of strengthening HPSR capacity is college education capacity in China. You know, HPSR is some kind of interdiscipline, right? So the HPSR research not only establish an independent subject in China and in other countries, especially in the underdeveloped countries, but also need to learn other subjects, especially about the methodology, including economics, sociology, and so on. Maybe this is my last point I want to share. Thank you.
Thank you very much, Ping. Miguel.
Thank you. Well, indeed, reflections for the Latin American region would be, I think, more directed to the question of the need for health policy and systems research towards the integration of health systems. As I said before, most of our countries are still characterized by highly corporatist, segmented systems, very inequitable, highly inefficient, with growing financial deficits, and of course, a growing rift in the capacity of systems to serve population needs. For the region, a health systems observatory capable of comparing efforts within and across countries, but also across other regions, especially, for example, with the European region, where countries in the south of Europe were very much like Latin American countries. I'm talking about Italy, Spain, Portugal, and Greece, that from the 1970s were able to integrate towards universal health systems. So we need to learn very much across regions, within the region, and within experiences in the country. And for this, I would very much like to open up the discussion of funding with alliance efforts, a regional health systems observatory to address these issues. Thank you very much.
Thank you very much, Miguel and Fadi.
Thank you, Echo. I think a lot has been said, so I'm not going to really repeat. I very much reinforce, echo all what had been mentioned. The only thing I would add is that this is just a start. Definitely, it's a means towards an end, as it was mentioned. I think the one thing that we need to keep in mind as we move forward to improve, to scale up that report and data required, is to also ensure that policymakers and stakeholders are also partners in this type of exercise as we scale it up. Second is also, it's good for each of our countries where we actually more engage with some of those key institutions or some of the institutions that were really part of that report, and see to what extent, what is the uptake of that report, to what extent that report provided some prompts for institutions to rethink their strategy, to rethink about integrating, being much more explicit in health policy and system research. To what extent this report also have shaped some thinking related to funding. I think we need to start really using this, again, scorecard to show where we are, but I think there's a lot of interesting insights that can come out when it comes to more of the post-report follow-up that we need to do, in addition to improving the methodology, the metrics, and the templates. Over.
Thank you very much, Fadi, and thank you to you all. So some really interesting and some very concrete points there about a short-term to a medium-term sort of agenda and an outline of areas of work and engagement. And we look forward to continuing to work and think with all of you on how we do these things and push the agenda to strengthen HPSR forward. So with that, let me now come to Dr. Ghaffar for the closing remarks. Dr. Ghaffar, over to you. Thank you.
Thank you, Aku. I think I just wanted to agree with all the comments the panelist has made in the second round also. I just want to have a reflection on one thing which Lucy said on capacity strengthening. And Lucy, like, I know you are one of the biggest champion, and the tragedy is when I joined the global health in 2000, global health research, the capacity was a challenge. Capacity remains a challenge, and there's a lot of discussion, but people are not moving. So we stand with people like you and everybody else, and whatever we can do, we will do, and we all need to do it. So there's no question about that. The one thing I just want to see it, like we are discussing, as I think Aku said in the 2017 report, we have a section on capacity, we have a section on networking, and we have a section on resource flows, funding at the global level. Because that needs like a bigger data system. So we might be doing the same exercises every 3 years or every 5 years, depending, but that discussion we are having. But we will like to keep on investing. What is the situation and status of the capacity to generate and use evidence? What is the capacity to work with each other globally, networking opportunity, and how much are the funds coming from different resources? The problem is the global data systems for fundings don't have a line item for health policy and system research. So your report becomes the primary source of funding, which one day will become the global cumulative number. So that is what we are trying, but there are different means and mechanisms. So I just wanted to say before I close that we remain committed, and that's one of the reasons that we are here, that strengthen the capacity, work with partners, not necessarily generation of knowledge, which all of you are doing much more and much better in your institution and the universities. So thank you, and we remain committed to your cause, and we remain committed to work with you and look forward to work with you. And I think now we are 2 minutes up. Aku, I think this is the right time that we can close. So thank you again and goodbye. And we look forward to work with all of you. Thank you.
Thank you.
Thank you, everyone. Bye-bye.
Thank you very much.
Thank you.
Thank you. Bye.
Bye-bye.